Hi, I'm Brayden,
I'm Ben.
I'm Andrew.
and this is the Campanile podcast. So recently, we went on Sunday. We went into stay-at-home orders, which means that restaurants have to close their dine-ins. Retail has to only operate at 20% capacity, and there's a lot of other closings within like businesses and activities. How do you guys feel about that?
Ben, you
Um,
want to-
yeah, sure. One thing, sorry, just to clarify, I was unclear about whether the state restrictions aligned with the county restrictions, because I heard that we were already, I think, at below 20% capacity in retail, in stores before the stay-at-home order.
I think that might be true. I think that it might be just like a mandatory thing instead of a recommended, maybe. I'm not sure. I'm sure that like the Bay Area is usually on the safer side and is trying to follow the recommended things. But it might have been just a mandate instead of a recommendation. I'm not sure though.
Okay, and you guys have to bear with me, but this is only for after 10 p.m. Is that correct?
I believe that was the curfew that was
curfew.
like a week ago or so, a little bit longer than that.
But
So I think this is like the actual stay-at-home order
Mhm.
that was issued by the county. So before it was that you couldn't be out doing activities in a group of people past 10 p.m. I think that was basically just.
Okay, and is that still enforced?
I think I think it's
Okay.
now just like not just 10 p.m. It's like whenever.
Got it.
I think it's enforced into businesses, but I know that like one of the things they talked about was like they enforce people like due to social pressure. So it's not that like I think you won't get arrested if you do it, but like everyone will look at you and be like, "Wow, what are you doing?" I think that's how they plan to enforce it. And I know
When there's less people out at 10 p.m., you stand up more.
yeah.
It's unclear how they really would enforce that. Like,
Well,
I think
and they shouldn't, like in my opinion, because if people do have a reason to go outside, and it's pretty important. Like there's some, if they're not like out partying in the streets or whatever, but let's say they had a long day at work and they need to go grab food at the grocery store really quick or something, and they can't drive. Like they shouldn't be arrested just because they're out on the street. So like I don't know, and it takes a lot of time for policing to figure out like motives for being out. So I think the social pressure is enough, especially here in the Bay Area.
I think another reason, not only but like to actually be able to, I don't know, maybe charge. So like the thing is like now if somebody has a party and people aren't wearing masks and they're all hanging out inside, there's like 20 people and they're in a group of people. I don't know, police officer gets called because they're violating like, I don't know, stay-at-home orders or something. This is pre-lockdown. I mean, I guess pre-new lockdown.
Pre-new lockdown.
So this is like what, over the summer?
Mhm.
Let's say that happened over the summer. A policeman comes inside, breaks up the party. Can he arrest anybody? Is there any charges he can can he charge anybody with anything? No.
I really don't think so, no.
So now that there's a stay-at-home order, the policeman can go, you're violating the stay-at-home order. You're inside somebody else's house. You're violating these emergency protocols. Here's a ticket. I don't know. So that's my idea. I think that maybe this is just, it's like an opportunity for law enforcement to take action on this.
To clarify, I'm not 100% sure, but I think the curfew is not that you have to stay at home after 10 o'clock, but it's you have to stay by yourself or with people in your family, I think. Like you can't, so you can go outside to run. I know you can go outside to run. You can go outside. I'm not sure about going to like a store, but I think you can go outside to do like activities with your family after, but not with anyone else. And that's the violation. It's going with other people, and then people know and can like see that you're with other people. I guess that's the social pressure is like how they plan on enforcing it. Do you think that'll work? Do you think that people will like think that, oh, people are gonna get mad at me if I go out, and they'll stay inside, or do you think they'll just ignore it?
I think around here people generally understand the importance of stopping the spread, that sort of thing. I don't know how true that is in other parts of state. I know there is an issue with that in LA. But I don't know. Around here, I think people follow orders. It's like, if like they understand this is for the greater good, and maybe if they're hanging out with, maybe they'll still like kind of break the rules by being with like a pot of people that isn't super strict or something. But generally, like if you're hanging out with some friends, I mean, I could see that happening, but I'm do not expect full-fledged parties, that sort of thing.
Yeah, for sure. Like I like if you've looked on social media, I don't know what your friends are doing, but I've seen some stuff where it's like a concerningly high like number of people in these crowds or whatever, and sometimes it feels like I don't know the young kids, maybe like middle schoolers, probably high schoolers too, are not adhering to the guidelines as strictly as adults are because maybe they think it doesn't apply to them. What do you guys do? You have experience with that or no?
I mean, I think over the summer, people kind of forgot about stuff. It's like you see people, I mean, people are still hanging out with no masks. They were outside, maybe even inside some of the time too. That was just kind of my impression that people were being less and less um, uptight about restrictions and that sort of thing. And people were enforcing it less too. Um, what we were seeing was people were acting this way, and we were actually going down in cases for a long time as this was happening. So people were like, okay, well, we're not harming anybody. What's the harm in hanging out with our friends? We're not seeing any effects of this. And now, once you have Thanksgiving travel and people are forced to stay inside, and it's like colder outside, so less people are necessarily hanging outside, and they're hanging out in their other people's homes, maybe. That's where you see spread of the virus.
Yeah, the
So,
inside outside thing is big. Like I
yeah.
think if you have a mask, you're outside, you're at least kind of enforcing like social distancing. I know when I see people outside, they're usually not like 6 feet apart, but they're usually not as close as they would be like without COVID. Like no one's like hugging each other or like all walking around right next to each other. Like a
Mhm.
little bit of social distancing and masks and outside, like with all those like things in place, the precautions, it's a lot harder to spread. Well, like it probably isn't the ideal situation, but like if everyone's outside with masks on, not super a lot of people in a pod, I think that can be reasonably enough, like to like at least keep it lower as we saw during the summer. But like once everything's getting colder, people are traveling, like the cases go way up, and I think that like people just think it get tired of staying inside, and I don't know, like I guess people don't realize that like by going like out and hanging out with other people and like seeing other people, they're actually like prolonging the time they're gonna have to like stay inside and the thing, and even like making the virus, I mean not virus, vaccine, sorry, less effective in the future.
You know, that's actually really interesting. So, especially like in Palo Alto, where it's like very bubbly, and we have a lot of people who, back in March started taking this thing very seriously right away. I've heard it from a lot of people that say like, if we've been quarantining forever, and you see on the news that no one really does anywhere else, no one wears their mask anywhere else, and so I'm just gonna give up because if everyone had stayed home in March, it could have been over in 2 weeks. Like I don't even know if that's scientifically true or not, but it's probably a stretch. But then there's like this definitely like this defeatist attitude, like there's nothing we can do anymore. What do you think students can do to like reconcile with that?
Um, it's really hard.
Yeah,
Uh,
like
it's like, yeah, I mean, I think it's like, just like do your part and hope that somebody else will follow. And
Exactly.
another mindset you can have, this is kind of like, in my opinion, an emergency mindset. Like this should not be the first choice, but um, think about it as maybe like a thing of, if you're really struggling to find motivation to stay inside and to stop the spread in that, maybe like look at it as like guilt almost. Like if you're going outside and you're being irresponsible, spreading the virus or something, like somebody might die because of you. Like that can have a really bad unintended consequence. And that's much less likely to happen um, if you stay at home or if you socially distance.
It sucks, yeah, it definitely sucks that like other people are going out and like, but like if people are, the more people that do their part, like the more effective it is, and if you're not doing your part, you're contributing the other way. So it
Yeah.
still is some effect if one person does it, and if one person does it, they can also make other people do it, and maybe you can have a chain reaction or something. I'm not sure if that's exactly how it would work, but like if like you don't want to do it, like it still makes impact. Every one person could make a huge impact, like how exponential spread works. Like one person could infect people who could all infect multiple people.
Mhm.
Like, yeah, but
It's also really hard to think about um, like the deadliness of the virus too. Like that's another that's a number that doesn't seem as scary as it actually is. Like, I think it's I don't know the exact statistic, but it is a small percentage of people that get the virus end up dying. But what you see is that the reason that that number has gone down and down and down as the pandemic has I guess evolved. You see, we're also increasing testing a lot, and so people.
Sorry, we're increasing what?
We're increasing testing. So if you think about it in March and in April, where people maybe thought that they got the virus, but literally didn't have access to a test because they were not at risk. They never know if they have immunity. They never know if they contracted COVID. So of the people that got tested, probably about half of them were the ones that were in hospitals. And you see a much starker percentage of people ended up actually dying from the disease than now. And I think that decline is also something that makes it harder to motivate yourself to stay at home. It's like, wait, it's only like what, 1% of people? Like, okay, I know like 2 people have gotten the disease. Like, it's so unlikely. Like, I mean, something like that is definitely, I think, something that people subconsciously think about when they make these decisions. But on a larger scale, it's like, it's much worse in other parts of the country than it is here. And even though we are kind of an isolated community, evidently it can spread.
I know a view in the other direction is like people saying that we should be able to go out is like they think that there's a specific group of people that are at risk, like an at-risk group. And a lot of people I've heard say like, why can't the at-risk people stay at home and everyone else go outside and like be able to live life instead of having their life limited? What do you guys think about that?
I can take that one. Like, I think that's a really like simplest mindset, and like it ignores the finer details of like how the virus actually spreads. So I think the problem in, I don't want to like generalize for the entire country, but I feel like a lot of problems in this country, like they come down to people not understanding like these it's not even that difficult to understand, but it's just everything is so dumbed down that like people don't understand that the virus is like airborne and it can stay in the air for like, I don't even know how many hours. It's not a lot, but it's still like 1 to 3 or something crazy. And like and it's just like they put themselves before other people so much, so frequently, that they try and make these little jumps between pieces, different little separate ideas, where, you know, if you jump from one to another, it kind of makes logical sense. But when you look at the big picture, which they don't do, it doesn't, and it doesn't work. So I think that's the mindset that a lot of people take to that.
Can you give an example of that jumping?
Wait, Brandon, can you like repeat the example you gave so I can relate it to that?
Yeah, some people think like people who are at risk should just stay inside and everyone else should be able to go outside.
Okay, so what I would say is people are like, okay, at risk, how do you catch the virus? You go outside, right? Because that's what the media is telling them. So then the logic is they're at risk. They shouldn't go outside. If they don't, solution solved, right? So that's kind of like, you're missing a lot of pieces. What about people who are, you know, asymptomatic and they don't know, or children are less likely to get sick from it or whatever, and they can still spread it on. So you're missing pieces from the puzzle. And like, I feel like a lot of people just know it deep down. They understand that they're missing pieces from the puzzle, but because it doesn't, because acknowledging that would interfere with their day-to-day, I feel like they are totally fine ignoring it. What are your thoughts?
Ignorance is bliss. Ignorance is bliss. It's less blissful when you're in a hospital bed hooked up to a ventilator. Yeah, I generally agree with that, but like kind of the factors that you do have to take into account is that like these people need to get groceries. They need to go, I don't know, there's essential things. They need to go to the dentist. They need to go to go to the grocery store. Maybe they have grandchildren or children that live with them. And is it really fair to make them quarantine? Is it really even fair to make these elderly people quarantine when in reality, in kind of the situation we are now, where we have a very low number of cases, but they are still rising, they can probably still safely go outside and operate their day-to-day life. It's unlikely that they'll get the virus just if they follow the protocols and that sort of thing. They do essential stuff. But the thing is that once the spread is like a third of the people in the community have it, that's much less safe for these older people to go out. And yeah, like they can't go get groceries. Like they might get sick. They have to get their groceries delivered. It complicates things for the people that are most at risk and the least able to adapt.
The saddest part too is that like I've seen on the news multiple times, people who have the disease, they can't or the virus, they can't see their relatives in their hospital. So they're like in their bed by themselves without any family members around them, without any friends. Like maybe they'll see them through like a screen or something, but it's really sad to like have your last moments alone in the hospital bed. That seems so like horrible to me and hard.
Did you guys see the video that went viral about this this older woman in hospice and her daughter was on the other side of the window, and this older woman in hospice was like her skin was turning blue or something because I don't know, maybe she wasn't getting enough oxygen. And when the daughter started complaining on rapping on the window to complain, they closed the curtain and wheeled her mother off, which was extremely disturbing. So like there is like you know, it was a viral video, maybe we're missing a piece there, but um there's a huge like the inequality in like hospice care and like care for people who have COVID, depending on how much money you can afford to pay for like uh keeping them quarantined and safe is also like another issue that we can talk about because like there's definitely a difference. Like in Palo Alto, you're not gonna have that problem, but
Yeah, I mean, ICU beds are, I mean, it's arguably not even about the money. And it could just be more about capacity. Like, we're all kind of going to the same hospital, like Stanford Hospital and that sort of thing. Like, what did they say? They projected ICU beds to be filled by Christmas.
no, I'm sorry. This woman didn't have COVID. I was talking about like
Oh,
it was either a retirement home or like some kind of hospice thing. But yeah, but ICU beds is a little different. But yeah, they're definitely. Have you guys seen like South Dakota? It's kind of crazy.
I
something
think
about in Texas too. I heard there was like 12,000 cases in
Yeah.
like a really small community or something.
people in like poor, like lower socioeconomic classes generally like work in more like in-person jobs that can't be online as much. Like I know a lot of people's parents like might just work online and they don't have to ever go into like an office or a factory or something. But I've seen like lots of stuff in the news too about like these meat packing plants or something like that, like the Jungle we read in the A Push. Like they don't even like they like make them keep going to work after like the COVID virus is already there, and eventually that results in deaths of many people. I saw one that was like there's these non-English speakers working at the factory, and they told the translators to like tell them everything was fine, even though everything wasn't fine. And that's really awful.
Yeah.
So like
That's
that maybe like the hospice care like isn't that, but like I know that like people like I feel like generally like wealthier people have less risk of having to go out and like do their job in person and risk getting it that way.
If I could butt in just a little bit, one of the articles I wrote this cycle was about the vaccine. As specifically, I interviewed a source who's the head administrator of the third round trial of, I believe, the Johnson and Johnson vaccine that's being tested at Stanford. Very knowledgeable man. He described something about how the vaccine would affect the rate of transmission and how it would go to those in lower income communities first. So it would be prioritized. Like if you think about it, like people who live in a house, like if you look at, I think EPA stats, there's an average of something like 4.1 people per household or like 3.9 people per household or something. In Palo Alto, I think it's like 2.1 or like 1.9. So that's a very significant change. So if you think about it, if one person in that household gets COVID, you infect an average of maybe one other person in your household, stays quarantined, all good. In EPA, this is, I know it's a generalization, so it might not be completely accurate, but this is just like the statistics. One person gets infected, they infect 3 other people. One of those people goes off to work in what tends to be like a blue collar job, and you see them pass it on to a lot of people that are not getting the same protections as somebody working in the ivory tower. And so in order to literally mitigate the spread, instead of just like whoever wants it more. It's like it's going to these lower income communities because these people have a higher risk of transmission than a lot of people in more affluent communities.
Well, they also have like sorry, Braden.
Oh yeah, I was just gonna say like that almost is the same thing I'm saying, because like the lower income communities have like more risk of getting it. That's why they're getting the vaccine.
They also have more risk of actually not being able to afford the medical care associated with once you get COVID. So like, I'm just no numbers here, but if you look at Trump, he's not exactly your average healthy male, right? And so if he can go into Walter Reed and come out totally fine, I heard that he took some very advanced like Regeneron drugs or something, extremely expensive, not available to the general public, especially people who are living paycheck to paycheck, which a lot of people are, right? That's just like, that option won't even be on the table for you, right? That'd be like life savings level of money that you're talking about. So it's also like, yeah, transmission is a huge factor, but you're also, by giving the vaccine out to these lower income people first, you're also helping them a little bit with, if the chance that they do get COVID, they have the vaccine, they're not gonna hopefully die from it. And the alternative being they spend a month in the hospital with these super expensive drugs.
Yeah, I mean, even if they do make it out alive, it's not looking good after that.
Well, and that's the thing. So for, is medical debt, I'm pretty sure medical debt is the largest debt for everyone in the United States, and it's over educational debt, right? And auto loans and stuff. So, medical debt can completely destroy your life and and like the lives of your offsprings too, which is kind of nuts. So a lot of people, unfortunately, do make the choice to not take the medical care that they would have received for a lot of money. Same reason why they take an Uber to the hospital instead of an ambulance, right?
Yeah.
You guys heard of that?
I have heard of that. That's crazy. It's pretty wild. It's something that I think a lot of people agree needs fixing. I certainly think it needs fixing. Yeah. So
do we want to talk about healthcare a little bit on here, or do we want to hit another topic?
Why don't we hit another topic? Because
okay.
I think we should talk about COVID guidelines. Andrew, so you're a high school senior. You are going through the college applications process. Braden and I are both juniors. So we have yet to experience that, although we're definitely feeling it coming. We're
ramping up.
If you could give us a rundown of what your last few weeks of college apps have been like.
Sure. So like under COVID, or like just in general? Because
under COVID and in general, like
how's it affecting?
What's different? Like it seems pretty similar to me.
Yeah, so there's just more uncertainty under COVID. That's the problem. So in a normal year, excuse me, and obviously I've not lived through it, and maybe in the future, if I ever have to do higher education, I will have to do another app. But for now, I haven't had the experience of like a normal college app process. But my understanding is that you do your EDs or whatever over the summer. You've already had your extracurriculars going. Test scores matter a lot. SAT, ACT, AP tests, subject tests, everything goes in there. Rec letters are done, and you kind of just do your EDs, you do your RDs, so that's regular decision, early decision, and then EAs, early action. You only get one of those, as I'm sure you guys know. So right now, for me, I've IED to a few schools, and then I'm RDing to the rest, and then it's all due like January 1st or whatever. So my winter break's gonna be pretty full. But the difference between this and a normal year is like I wasn't able to get any subject tests at all. So that's the College Board. You took AP tests, right? Last spring?
I didn't, no.
I haven't yet either.
You didn't either. They were pretty janky, so I don't want to make this podcast about me, so guys like tell me when to stop. But in my experience, like I never got my e-ticket for one of the tests, and I had to wake up at 5 o'clock and call the College Board because they're on the East Coast or whatever, and call and beg them to let me take the bio test. It was a giant disaster. The tests were super buggy. Everyone complained you couldn't submit anything. So everything's super confused. And also across the board, I know ED at a bunch of schools is up 16 to 20%. No one has any test scores, so they're throwing their hat in the ring, even if normally the schools would use test scores to weed out some applicants. And on top of that, it's super hard to find a ACT SAT. So I'm actually, it's kind of funny because I'm leaving tomorrow for taking an ACT in Nevada. And so it kind of raises the question of, is that fair? So the UCs, they got sued, and the judge ruling that found that, it's not fair for disabled people who can't travel, or, you don't have the money to. But like, there are colleges who aren't test blind that I'm applying to. So
are there colleges that are not test optional? That are like
every college is test optional, I'm pretty sure, except for some colleges in Florida, I'm pretty sure.
I remember I was at a little webinar thing for I think it was Georgetown. It was Georgetown and a couple other schools, but Georgetown is test required.
There are a few, especially in the South. Yeah.
Georgetown, but
and Florida has seen a massive decrease in admission and people doing ED there. So it's massive. I'm not sure.
I mean, it's been a bit evident, especially from people around here. I can imagine that lack of COVID responsibility in some southern states. I mean, no, I'm not trying to generalize or anything, but Florida was pretty poorly off at first, and I think people saw that. They're like, if this is going to get worse, I don't want to be there.
Actually, this is kind of interesting. So there are two sides to this. The first side is I took my test score. I was super prepared in the 2019 academic year. I took my ACT early. This is the average person on this side. That's not me. I was trying to
yeah.
Unfortunately, I had a test lined up, but I got sick, and then COVID. It wasn't COVID. That was like December. So these people are like, I studied the summer of junior year for this, right? Like I prepped way in advance. I deserve to turn in my score. And then there are other people who didn't study over junior year. They said, okay, I'll do it senior year, like 70% of people or whatever, right? That's pretty normal. And then they can't, every testing center in California, or there are a few, especially for the ACT, who's been opening testing centers in like airports and places, but for the most part, it's extremely hard, right? So they don't have scores. So what do you guys think about that? Is it fair to submit scores?
I know that scores can really affect your admission, so I'm not sure actually at all, but at the same time, not having a score could also affect your admission the other way. So like, it's really hard to do, and college admissions are already kind of like really like up to chance, and this makes it even more confusing, like how everything's working, how it's super stressful. I haven't done any like really anything for college admissions yet, but I've just heard it's super stressful. It's super uncertain, especially like, have you guys visited any of the college? I know people usually do college visits with COVID. How was that?
I have not visited any colleges, and my impression is that a lot of seniors are hanging on until it's absolutely necessary to visit a college to see after you see which ones you got into and that sort of thing. But one other thing I'd like to add about the ACT SAT thing, I think that I'm really torn actually. Ethically, I think it's completely unfair to allow some people to submit scores and some people not to. But however, I do see some merit where there are some students that are particularly good at taking tests. Maybe they're in a class where that's not as evident, that weighs down on their GPA. Usually they'd be able to make up with that with a test or something like that, with an ACT or an SAT. People who have invested a lot of money and time into prepping it, it's also not quite fair to cut that off.
People with tutors, yeah.
My thing is that I think it's okay to make everything test blind as long as you tell people now. It's like, if people are going to invest money into into prepping for a test that they won't even take, like that just also doesn't feel fair. You should, like, the option, to me, it's like the option is fine. It's not perfect, but it's okay. And when you completely cut people off from doing something that they've invested hours into, that doesn't feel quite fair. So yeah. That's what I got.
Yeah, no, for sure. There are a lot of people who were relying on this, right? As you said, it's a great equalizer. What
Yeah.
if you have a lower GPA? Well, in a normal year, if you ace the SAT, you got 1600, 1550, whatever, in the upper echelons of the score, you were still competitive, even with like a 3.5, right? Or
Mhm.
I don't know, a 3. So it's like, I'm talking about the Ivies, obviously.
Mhm.
You know, different scores for different tiers of school, but that's just kind of, you're taking it away from a lot of people. But at the same time, like, there are so many concerns. Even just going to the testing center, you know, you're in a room with 50 people, right?
Yeah.
And that's a COVID concern. So is that fair either? No. So I don't
Yeah.
know. You just got to weigh it.
Yeah. I was gonna take a ACT at SFO actually in 2 days, but
Yeah.
it got canceled about a week ago. Um, I was looking forward to getting that over with, but I also wasn't super optimistic. Um, so I'm just, my goal is just to take it as soon as possible. I think once again, for me, it might be a good equalizer. I might do better on it than my other grades. And if I don't, hopefully things will be test optional that I don't even have to submit it. Thing is that like, I think you see, I can't imagine a scenario where you don't have to submit your grades to college or something. However, test scores, that's a bit of a gamble. Like we aren't entirely sure how that's going to work yet for the coming year.
I mean, scores are already like up in the air. People like are saying, "Oh, why does a test score like have to determine like how good you are in a certain way?" Like especially one that's not in school. Like I know that people already like had like their doubts about like standardized testing like in college admissions, and I think that this might be like a step even after COVID's over to like.
Yeah. So one thing we did see, I think I can't remember if it was before or after COVID, but the UC's announced that they're going to redo their system. They're not going to, and I think they said 2022 or 2024 or something. They're going to phase out the SAT and the SAT, and they're going to have you take their own test that they're developing. I think the intention behind that was that people thought the SAT and the ACT was discriminatory. It's like it's situational. You can pay a lot of money in prep and evidently do better. There are aspects of the test that are less familiar to, like I remember I heard something. There was like a question. It was on an SAT or an SAT a long time, not a long time, a couple of years back, but it was something about like a regatta and like something to do with like boating. It was like a math question, and it was, I think they had evidence that like 80% of people who live near the coast got it right, and like 20% of people
Oh,
who
wow.
didn't got it wrong. And it was like there are little things like that that are not perfect. Um, and I think the idea behind less standardized test is to, yeah, I don't know, mitigate that in some way.
And just
For
mitigate
sure.
the whole process of like even more stuff when applying to
Mhm.
colleges, like
Yeah.
the added stress. Maybe I'm not sure. Like, how are your essays and stuff you have to do per each college, Andrew?
Um, uh, you mean like in general, like how? Like, I
Sorry,
don't
hold on.
understand
I
exactly.
need to interrupt you, Andrew.
Yeah.
FDA just approved the Pfizer vaccine.
Really?
Really? We
Yeah,
got it in just now. That's
we got it in just
congratulations.
Wow.
now. I just got that notification on my phone.
Did you see
That's
Canada approved it yesterday?
Canada approved it yesterday.
Yeah.
Um, I think they did it in an independent study, which
Yeah.
is the same way that they do like a good comparison to that is that like I think I could be mistaken on this, but I think it's the same way that news outlets call the presidential race. It's like a panel of people that is isolated from all the other information, except for the raw data on the vaccine. So they can't be influenced by Britain authorizing it or by
Got it.
other countries authorizing it. It's like, oh, if we're the only, like, we're going to do it when it's safe, not when every other first world country is done. So I think that's how Canada did it. My concern is that the FDA didn't do it that way. I think that would make us the fourth. I think Bahrain and the UK and Canada were the three before us. Yeah.
That's crazy.
Mm-hmm. Well, it's the beginning of the end, guys.
Sure is.
Hopefully this will be a silver bullet.
I'm surprised they got it out that fast. Yeah.
Yeah, when I was interviewing one of my sources for this vaccine story, his estimate was that it would be approved for general use in March, mid to late March was what he was saying. I believe that this is EUA, so emergency use authorization, going to healthcare workers and those who need it most. Honestly, I don't think this is going to make too much of a difference for this happening between now and March. It's like the biggest limiting factor at this point is how many doses of the vaccine we can produce, and less about how early we can administer them.
Yeah, how fast do you think they're going to administer them to the public? Do you think they're going to start soon, or do you think?
Oh, they're starting now. I mean, there's probably people who are getting it in 10 minutes from now that are waiting till they get the approval. They have the doses ready. They don't have a lot of them.
How do they plan like the whole administering? Do you know?
So that's unclear, but I think the idea from the FDA was it's going to healthcare workers. It's going to people. The first two groups of people that are getting it are people in nursing homes and healthcare workers. Mm-hmm. After that, probably more at-risk people, frontline workers, teachers, elderly, that kind of thing. And then people with additional health risks, and then the general public. So we're probably going to be the last people to get it, assuming that none of us have underlying conditions.
That's reasonable, but that's interesting.
Yeah.
All right, guys. Thanks for listening to the Camping Podcast.
There we go.
Stay safe.
Stay informed.
And stay classy.